Good morning, ladies and gentlemen. I am Colonel Dr. Anup Krishnan, and it's my privilege to welcome you to Week 1, Lecture 3 of the course on Physical Medicine and Rehab in Sports. Today, we will be discussing common soft tissue sports injuries. I'll be covering this lecture as per the following outline: introduction, types and management of soft tissue injuries, principles of soft tissue injury management, return to play guidelines, special population, future trends, and we'll conclude with a take home message. How do we define soft tissue injuries? Soft tissue means something other than bone. So, damage to muscles, ligaments, and tendons due to trauma or overuse is defined as soft tissue injuries. In sports medicine, it is very common amongst athletes, and proper management ensures quick recovery and, more importantly, prevents recurrence. The management strategies include immediate care, rehabilitation, pain management, and prevention. There are different types of soft tissue injuries, such as muscle or tendon strains due to overstretching or tearing of muscles or tendons, sprains, which are ligament injuries due to excessive force, contusions, which may be bruises due to blunt trauma to soft tissue, tendinopathies due to chronic tendon irritation and inflammation, bursitis. Bursa are fluid-filled sacs which reduce friction in the joints, and inflammation of this bursa is called bursitis. Strains. Overstretching or tearing of muscle or tendon fibers is called a strain. Common causes are sudden acceleration, deceleration, improper warm-up, and muscle fatigue. The symptoms are pain, swelling, bruising, reduced range of motion, and muscle weakness. The immediate care involves RICE protocol, or as we call it now, police protocol, within 24 to 48 hours. The rehabilitation involves gradual stretching and strengthening, massage therapy to reduce scar tissue after the initial phase of inflammation, and physical therapy for muscle re-education. Prevention of strains, proper warm-up before activities. If the muscle is strong, if it has been adequately strength trained, then muscle endurance will be there and there will be reduction in muscle strains. Whatever sports you're playing, make sure you're doing it with the proper technique and with proper biomechanics. Ligament strains or ligament sprains are partial or complete tears of ligaments. Common sites are ankle, knee, and wrist. The symptoms are pain, instability, swelling, bruising, and difficulty in weight bearing. Management: immediately police protocol within 48 hours. Gentle mobility exercises to prevent stiffness. Strengthening exercises to target the affected joint stability. Bracing and taping for added support may be required to enable the sportsperson to at least start getting back to daily activities. Return to play is only done after the sportsperson passes certain functional tests such as single belt balance, agility drills, etc. And during return to play, make sure there is a gradual reintegration into sports activities. Contusions. Contusions or bruises are due to direct trauma which lead to capillary rupture and bleeding under the skin. The symptoms are discoloration, swelling, pain, and stiffness. Management, again, police protocol or RICE protocol for the first 48 hours. Start gentle stretching to maintain the range of motion, and pain management with non-steroidal anti-inflammatory drugs may be required. Avoid aggressive massage in the early stages to prevent myositis ossificans or bone formation in muscle tissue. Tendinopathies. Tendinopathies are generally an overuse injury which lead to tendon degeneration and inflammation. For example, Achilles tendinopathy, patellar tendinopathy, and lateral epicondylitis. Symptoms: there is a gradual onset of pain, morning stiffness, and thickening of the tendon. Management: initially, it has to be rest to reduce the load on the affected tendon. Gradually, we start a progressive strengthening program with eccentric exercises, isometric exercises for pain relief. We may use shockwave therapy, ultrasound therapy, or dry needling for pain relief and to reduce the inflammation in the tendon. And corticosteroidal injections may be given locally around the tendon, but it has to be used with caution, because if you give a corticosteroid injection wrongly into the tendon, you may cause a tendon rupture. Bursitis. It is an inflammation of the bursa due to repetitive stress or direct impact. As we discussed, a bursa is a fluid-filled sac which is present around the joints to reduce the friction during movements. The common location of bursas are shoulder, knee, and hip, and the commonly involved conditions are subacromial bursitis of the shoulder, prepatellar bursitis of the knee, and trochanteric bursitis of the hip. The symptoms are localized swelling, warmth, tenderness, and there will be pain with movement. Management: initially, RICE or PRONICE protocol to reduce inflammation. You will definitely need non-steroidal anti-inflammatory drugs to control the pain. Physical therapy to strengthen the surrounding muscles, which will in turn reduce the stress on the bursa. And in severe cases, corticosteroid injections will be required inside the bursa to reduce the inflammation and manage the pain. So what are the principles? Principles for acute injury management: usually police protocol, protection, optimal loading, ice, compression, and elevation. Protection with braces and crutches if needed to give rest to the damaged tissue, and make sure you ensure that there is controlled movement to prevent stiffness in the joint, the tendons, and the ligaments. In the acute phase, reduce pain and swelling with RICE. In the subacute phase, regain motion and strength through progressive exercises. And in the functional space, sport-specific training and plyometrics. Please note when to progress the exercise, how to progress the exercise, how much to increase is more of an art rather than a science. And this will only come with experience. Pain management strategies include medication such as non-steroidal anti-inflammatory drugs and paracetamol. Opioids may be used in severe cases But please be aware about the anti-doping rule regulations for sportsmen regarding use of opioids. Manual therapy, including soft tissue mobilization and joint manipulation, may be used. Heat and cold therapy may be used based upon the phase of healing. What is the role of physical medicine and rehab? PMR uses modalities to reduce inflammation, reduce pain, and to promote healing. PMR uses a variety of manual therapy to restore mobility, such as massage, soft tissue manipulation, myofascial release, etc. Different types of strength training may be used to prevent re-injury. Again, I repeat, what exercise to prescribe, how much exercise to prescribe, when to progress the exercise, when to go to the next phase, and when to certify an individual fit for sport is more of an art rather than a science, and it will more come to you with more and more practice. Neuromuscular retraining for coordination and balance to improve balance, proprioception, and obstacle avoidance. Drug therapy may be required as modalities, exercise, and other therapies may fail to control pain and inflammation. The PMR specialist may use bracing and taping to enhance proprioception and to prevent excessive joint movement to give rest to the damaged tissue. The types of taping are rigid taping or it may be kinesiology taping. Surgical interventions may be required in cases of complete ligament rupture and severe tendon tears. The usual procedures used are ACL reconstruction, rotator cuff repair, and Achilles tendon repair. Return to play guidelines. They are based upon pain-free function, strength, and sport-specific drills. Return to play is an important topic which requires a course by itself, and it is difficult to cover it in one lecture. However, we have to look at whether the individual is pain-free, whether his strength has come back in relation to the non-affected limb, and whether the individual is able to complete several sport-specific drills or not. More importantly, we have to look at whether the individual is psychologically ready to return to sport. And when you increase the workload, increase it gradually to prevent re-injury. There are several injury prevention strategies which can be used. When you are doing any training or competition, make sure you do proper warm-up and cooling down. Make sure the load management is appropriate during training and during competition for the athlete. Regular strength and conditioning has to be part of the training program for the athlete to prevent injuries by improving muscle strength and coordination. Make sure the athlete is doing proper training using proper biomechanics and he is using the correct footwear for his sport and for injury prevention. If any orthotics are required for injury prevention, make sure they are prescribed appropriately and manufactured using proper manufacturing techniques. There are several signs of overuse injuries, and make sure your athlete and coaching staff is trained to recognize these early signs of overuse injuries. There are several targeted injury prevention protocols. Example, FIFA 11 Plus, which is a targeted injury prevention protocol for prevention of injuries in lower limbs in football. Similarly, there may be injury prevention protocols available for your sport, or you may modify existing injury prevention protocols. Youth athletes may show several growth related issues, for example, Osgood-Schlatter disease. Youth athletes are at a higher risk for repetitive stress injuries or overuse injuries. And please ensure that the training program which is prescribed for youth athletes is age specific as per his biological age. Older athletes may show reduced tendon elasticity and slower recovery. For these athletes, it is very important to prescribe proper warm-up and mobility exercises so that the tendon becomes elastic, the muscles become elastic, and you can look at the recovery in a highly specific fashion. Older athletes will require preventive measures to avoid chronic injuries much more than normal young and adult athletes. There are several future trends in soft tissue injury management. For example, advances in regenerative medicine, including platelet-rich plasma and stem cell therapy, which have come into this field and is advancing very, very fast. PRP and stem cell therapy is showing good results in management and treatment of soft tissue injuries. The use of wearable technology is increasing in injury prevention and more importantly for load management. And nowadays we are progressing towards artificial intelligence based rehabilitation programs for soft tissue injury management. What is the take home message? Common soft tissue injuries seen are strains, sprains, contusions, tendinopathies, and bursitis. The immediate care involves RISE or police protocols for pain and swelling management. The rehabilitation protocol involves gradual strengthening, mobility exercises, and physical therapy. Pain management using non-steroidal anti-inflammatory drugs, manual therapy, heat and cold applications may be required. Return to play is done only after functional testing, ensuring that the workload has been progressed scientifically and ensuring that the athlete is psychologically ready to return to play. Make sure he or she has undergone a proper strength training program with proper biomechanics and early injury recognition. The future trends for soft tissue injury management involve regenerative medicine, artificial intelligence driven rehabilitation, and wearable technology for load management. These are the references which have been used for making this presentation, and I strongly urge you to go through them in the interests of better understanding. Please note that there will be a weekly assignment at the end of the week, and there will be a course ending test which you will have to pass to get a certificate. So ensure that you have gone through all these reference programs well. Thank you for listening, ladies and gentlemen. Thank you and Jai Hind.